Bro, quit smoking already. Your skin tone is changing.
You don't get it. It feels amazing. You want a hit?
No thanks. I'd like to live a little longer.
Come on, take it. Try it.
Warning, this lung is in serious trouble.
This lung has severe smoking damage. We have to remove it completely.
No, don't remove me.
Oh my god, that's terrifying. Smoking kills.
Wait, what's that in your hand just now?
You're seeing things. Lungs don't even have hands.
Doctor, how's my lung?
Long-term smoking has caused disease in part of your lung tissue. To prevent infection from spreading or turning cancerous, we've removed an entire lobe of your lung. You can still live a normal life, but you must quit smoking completely and follow pulmonary rehabilitation exercises.
Whew, I'm stuffed. Wait, what's going on? Why is everything shaking so hard? Hey, up there! Quit bouncing around! I can't hold on much longer!
Ooh, this workout looks good. Bet this burns fat fast. I gotta keep up.
I'm serious! Stop shaking already!
Who are you?
Doctor, what's wrong with me?
Your stomach prolapse is pretty severe. This happened because you've been doing intense exercise right after eating for a long time. From now on, wait at least 1 to 2 hours after meals before working out.
If you engage in strenuous exercise immediately after a meal, blood will be forced to redistribute to the muscles and bones, leading to insufficient blood supply to the digestive system. This can affect the normal digestion and absorption of food, easily causing stomach discomfort, abdominal pain, or even gastric prolapse. Therefore, it is best to wait at least 2 hours after a meal before engaging in strenuous exercise.
How'd so much water get in here? Can't you be more careful when you're showering? Hey, buddy, how'd you end up in there? This isn't a place you're supposed to live.
Come on, man. Have a little pity on me. I've got nowhere else to go.
All right, you can stay here for now. You still haven't found a place? I'm running out of room in here. You need to move out.
Move out? It took me forever to get in here. I'm not leaving.
Something's wrong. You're about to make me burst.
Why'd you burst? I don't want to leave.
Doctor, what's wrong with my ear?
You have otitis media. Otitis media is an inflammation of the middle ear cavity, usually caused by bacterial or viral infection. Its most common cause is a cold or upper respiratory infection, which prevents fluid from draining from the middle ear cavity, allowing viruses or bacteria to thrive. Most cases clear up on their own or can be treated with antibiotics, but severe cases can damage your hearing.
Doctor, were you talking? I didn't hear a single word you said.
Oh, what bad luck. How did it just snap off like that? Wait, isn't this the half that broke off before? Can't use it anymore. Why'd you bring it back?
After your tooth broke, I kept this piece in some milk. We can actually reattach it.
Huh, I've only heard of reattaching hands or feet. Didn't know you could do it with teeth, too. All right, let's do it. What's this?
That's resin. We'll use it to glue your broken tooth back on. Then hit it with a curing light and you're good to go.
Wow, it's actually back on.
Luckily, the pulp wasn't damaged. Makes the repair easier. Otherwise,
Otherwise what?
it would have cost you more.
After a tooth breaks, it can be repaired with composite resin. The dentist will first clean the fractured area and perform a micro-etching treatment to make the resin adhere better. Then, the resin is filled in layers and hardened layer by layer with a light curing lamp. Finally, it is polished to restore the shape and bite of the tooth, making it both beautiful and strong.
Why am I always the one suffering? It hurts like hell. What are you doing? I'm about to put you to sleep for a bit.
But cutting out a chunk like that is gonna look weird.
I literally just took this from his thigh. Here, use this.
But the color doesn't even match the tongue.
Why do you care so much? It's not going in your mouth anyway. Huh? Why do I feel different after waking up from surgery?
Hey, why are you poking me?
Why is there so much hair on you?
Doctor, why is my tongue growing hair after the surgery?
We use tissue from your thigh to repair it. Hair growth is totally normal. It'll go away after a while.
Tongue reconstruction surgery is mainly used for cases of tongue loss. During the surgery, the doctor will take a piece of skin tissue from the front and outer side of the patient's thigh and shape it into the shape of a tongue to repair the damaged tongue and rebuild swallowing, speech, and sensory functions as much as possible.
What's wrong with me? Am I getting sick or something?
How would I know?
Ah, there it goes again! Why won't it stop?
Why is it coming toward me now? Hey, stay back!
Honey, what's wrong with you? We need to get you to a hospital, now.
Whoa, it's gone.
Doctor, what's going on with me?
You have epilepsy. I performed a corpus callosotomy, which cuts the bundle of nerve fibers connecting the left and right hemispheres of your brain, the corpus callosum. This can greatly reduce the risk of serious injuries caused by sudden falls.
Hey, old buddy. Life's been pretty boring since menopause. Thank God I've got you here with me.
Good thing you're so adaptable. I've been here for years, and you've handled it pretty well.
Tell me about it. Anyone else would be dealing with monthly cramps.
Your time here was only supposed to be 10 years or so, and you've been around for 2 or 3 decades. Time to go. This string's too old. It'll snap as soon as I pull. Oh well, bring me the extraction forceps. You should have had that IUD removed a long time ago. The longer you wait, the more damage it does to your body.
Ugh, it's that time of the month again. It feels so stuffy and damp. Seriously uncomfortable. Hey, who are you? No random people allowed.
I'm a tampon. I can replace pads. I absorb your menstrual flow directly, clean and hygienic.
I've heard people say girls who use those are kind of not very proper.
What era are we in? People still think like that? If anyone says that again, just slap them.
Wow, it really works. It's absorbing it. It actually feels pretty great.
Just remember to change me every 2 hours.
The tampons you recommended are really great.
All stitched up. The C-section is almost done.
Having a baby is such a pain. I'm never doing this again. Might as well get me fixed while you're at it.
Fair enough. No need to suffer twice. But just so you know, getting fixed makes it really hard to reverse later, and it might mess with your periods and hormone levels.
I've made up my mind. No more kids.
All right then.
I heard all that plotting just now. You really gonna cut me off?
Yep, that's the plan.
You better not regret this.
All done.
Finally, I don't have to go through that pain again.
During a cesarean section, if the mother has clearly decided not to have children again, the doctor can usually perform tubal ligation before the surgery is finished. Because the abdominal cavity is already open, the doctor can directly see and treat the fallopian tubes, so no additional incision is needed, essentially combining 2 surgeries. This reduces the risks of readmission and anesthesia, and also eases the recovery burden.
What are you doing? I'm not ready yet.
It's a C-section. Whether you're ready or not doesn't really matter.
You made such a huge cut in me. Ah, why am I bleeding? What are you waiting for? Hurry up and contract so you can get me out of here. I don't know how. The baby was taken out through the incision. Fine, then don't blame me if I cause an infection. Oh no, what am I supposed to do now?
Doctor, I've been having this heavy, aching feeling in my lower abdomen. Something doesn't seem right.
There's pooled blood inside your uterus that hasn't been expelled. This was likely because your abdomen wasn't pressed after your C-section. Postpartum abdominal massage helps the uterus contract and push out the trapped blood. You should start gently massaging your abdomen as soon as possible to encourage uterine contractions. If the blood stays there too long, it could lead to serious complications, such as infection or even shock.
What's going on? Why is it all backed up ahead?
Don't you see that huge baby right there?
Then how am I supposed to get out? Forget dragging this out. I'll just fix it for you.
Stop! That hurts like hell! Don't move!
Let go of me! I'm almost there! Hey, you two, knock it off! I'll help you sort this out.
Doctor, why do I keep having blood in my stool after getting pregnant?
During pregnancy, the enlarged uterus puts pressure on the rectum and pelvic blood vessels. Along with hormonal changes that cause veins to expand, this can easily lead to hemorrhoids or anal fissures, which can cause bleeding.